It's a 2-year fellowship program, and first year we focus on acutely ill children and adolescents. That include inpatient services, consult liaison services, emergency services, as well as our unique day treatment program where it is trauma-informed and integrated our educators in it so that our children and adolescents can learn as much as possible while getting treatment. What we're really proud is to expose you to very diverse children and adolescents within the New Orleans community. And so you will actually get a really good clinical experience from a cognitive behavior therapy or psychopharmacology in a different variety of settings.
I think that Tulane is really unique in the sense of it takes a pretty holistic approach to patient care. We really do think a little bit about what's going underneath a lot of the behaviors that we see.
Tulane Child and Adolescent Psychiatry program has a special focus on infant mental health, which I think is really important because you're able to make a huge impact not only on children, their families and caregivers, but also the wider society when you're able to intervene this early.
Tulane, though an academic institution, collaborates with a lot of community-based programs. We get an opportunity to work with the Child Protective Services in their clinic and take care of kids who have undergone extensive trauma or racial bias. We serve communities that are financially, economically underserved and are unable to avail services, which I find is something that is very close to my heart. That's something that I've always desired to work with, and I'm getting that opportunity here.
Tulane has taught me that building rapport with children exposed to trauma is very important. I've also learned that incorporating culture into evidence-based treatment is not only possible, but is very necessary.
I think it's a combination of a truly academic program with a commitment to our community. And we do a lot of outreach and partner with our community clinical sites and really reach out in a very mindful of trauma-informed practices, because New Orleans itself has a lot of trauma and our citizens actually experience a lot. So we're very mindful of that, as well as a diverse culture that the New Orleans possess.
I think that we offer a small town type of feel in a place that has a lot of great faculty members that do a lot of research and do a lot of interesting clinical work.
The faculty really take their time to make sure that they can teach you how they kind of go through their thinking and how they break things down, and then how to kind of approach each problem. As well as just remembering to focus on strength too, and thinking about the person as a human being.
Personally speaking, I just feel like the family here at Tulane, and I have to call it a family, have just been so inclusive, so welcoming. They have opened their hearts to me and my other fellows.
In this program, people are very warm and welcoming, also very supportive. We're told constantly, and we actually do feel it, that we're not in this alone.
You can certainly learn how child and adolescent psychiatry anywhere, but having a really supportive community that feels like they're constantly behind you and want to do their best and support you however they can is really, really important to me, and I imagine to future people at the fellowship as well.
Of course, we want to actually have a well-rounded applicants. And academics are important, but at the same time, this passion for the public service, it's a really key to make a successful applicant for our program.
If you want more experience dealing with very young children to the adolescent age, and also being equipped with the tools to be able to help persons who are suffering from the effects of trauma, then the Tulane Child and Adolescent Psychiatry program will be good in helping you to do that.
I can only say that my experience has been enriching, it has been fulfilling. I feel like I am learning the most that I can, and I will always thank Tulane for providing me this wonderful opportunity.